We're looking live at Queen's Park in Toronto right now, where the provincial government has just finished announcing its 2023 budget. With uncertain global economic conditions and high inflation, some Ontarians were looking to this budget for help. The CBC's Megan Fitzpatrick is live at Queen's Park and has all the latest details for us. So, Megan, what were the key takeaways from the province's budget announcement?
Well, Andrew, one of the key takeaways is that Ontario is on a shorter and faster path to balancing the budget. Today's budget is projecting a surplus now in Ontario in 2024-2025. That's 3 years earlier than was projected in last year's budget. So in terms of where we're at in terms of the deficit, they're projecting this year, this upcoming fiscal year, Ontario will run a deficit of $1.3 billion, but then the following year, the surplus will be about $200 million. So not huge, but not in the red. And they're saying that the year after that, the surplus would jump up to $4.4 billion. So how are they getting to this balanced budget? Is it through massive spending cuts and program cuts? It's not. It's quite the opposite. This is another big spending budget from the Doug Ford government, a record amount of spending, really, more than $200 billion in spending in this budget. That's on program spending and also on interest payments on the debt. So why they're getting to a balanced budget faster, they're saying in large part is because of huge revenue growth here in Ontario. And that's in part because of higher taxation revenue, they say, that's coming in. Inflation plays a part of this as well. As well as last year, for example, Ontario was maintaining a reserve fund for emergencies, essentially, and it wasn't used. And so that sort of went towards paying, reducing the deficit as well. Now, Finance Minister Peter Bethlenfalvy is saying, there are uncertain times ahead, that Ontario needs to be responsible and prudent. And so it will continue to maintain a reserve fund this year and as well a big contingency fund as well. So this is money that's set aside, not necessarily dedicated to any one specific program at this point. He was trying to say that Ontario's economy is resilient, but again, there's uncertainty ahead. Now, in terms of what they are spending all that money on, Andrew, budgets really kind of summarize program spending. So I'm not going to go through sort of what we've already heard from the government in terms of what we already know they're spending money on. In terms of what's new in this budget, I'll highlight a couple of things. One is some extra relief for low-income seniors in Ontario. They're going to make some modifications to a program called GAINS. That's the Guaranteed Annual Income System. They're going to change essentially the eligibility criteria for it so that more seniors, about 100,000 more seniors in Ontario, will be able to get this benefit. And starting in 2024, they're going to tie the amount of the benefit to inflation. So they're saying that this will help more low-income seniors in the province. Tax cut for businesses in this budget, small businesses. Again, they're going to make some modifications around this so that more small businesses can qualify for the lower corporate tax rate for small businesses. They're estimating this will help more than 5,000 businesses in Ontario pay less tax. There's no tax cut in here for individuals, so if people were hoping for that, they will be disappointed. There's also a tax credit for manufacturing businesses that was announced earlier this week. On healthcare, that's a big issue we've been covering a lot lately, a lot of pressure on the healthcare system in Ontario and other provinces. $81 billion being spent on healthcare this year. That's up from $75 billion last year. A couple new things around this. They are adding some more money than was already budgeted for mental health and addiction services in Ontario, an extra $425 million there. Another thing people should be aware of, this isn't necessarily a spending measure, but recently the government allowed pharmacists to prescribe some over-the-counter medications. They're going to expand that list of medications that pharmacists can prescribe, and that will start this fall. That will include acne medication, canker sore medication, diaper dermatitis, a couple of other health conditions. Also, we got a price tag for the amount of money they're going to spend to move surgeries and procedures out of hospitals into community clinics, some of which will be private for-profit clinics. $72 million being set aside to have surgeries done in those settings, and an extra $202 million per year for homelessness prevention programs and supportive housing programs. Those are a couple of highlights there, Andrew, in terms of what they're spending extra money on that we didn't already know about.
Megan, thank you. The CBC's Megan Fitzpatrick live in Toronto.